Rayfield, members of the committee. For the record, my name is Lee Mercer, Mobilization Chair and former President of Healthcare for All Oregon. HCO is working towards universal publicly funded healthcare in Oregon. We currently have nearly 23,000 supporters in our database, 120 member organizations, and over 160 supporting businesses. As we meet with Oregonians in our canvassing, tabling, speaking, and film events, we hear hundreds of stories of individuals suffering from lack of health care or health care costs they are experiencing. Until we reach universal health care, hundreds of our members have been active defending health care coverage by speaking out at town halls throughout the state against repeal of the ACA, which would, by the CBO, throw 22 million Americans off of health care. Similarly, a no vote on referendum 301 will throw potentially hundreds of thousands of Oregonians off the Oregon Health Plan. It is important that the danger of loss of health care to thousands of Oregonians is reflected in the language of LC 25. I'm also on the executive committee, former director of Main Street Alliance of Oregon. Currently,
Mr.
with
Mercer,
about,
can you move a little bit farther back from the mic?
It's back?
Just back a
okay,
little
I'm
bit.
swallowing the mic. Okay. I'm also executive committee member and former director of Main Street Alliance of Oregon, currently with about 3,000 small businesses statewide on our statewide list. Many of these small business owners depend on OHP for their health coverage. In Silverton, where I live, there was a story in our most recent Our Town newsletter about area resident Randy Traeger, known for his family's signature product line, the Traeger Barbecue. Randy has recently undergone not only one, but 2 liver transplants, which, due to ongoing medical costs, have forced him to depend on OHP and disability. This is an example of how anyone may need OHP to get through hard times. The current draft ballot title fails to convey the human impacts of referendum 301. Voters are not told that hundreds of thousands of Oregonians face losing their Oregon health plan coverage, and thousands more could see their premiums rise.